Today, I would like to share on the menopause. So first, how do we diagnose someone? Like if I'm a medical doctor, how do we diagnose someone that they have reached menopause? What do you think? Pardon? Oh, okay. Correct. No more men or no more menses. Okay, so basically it seems like from the Greek word, man meaning for them is actually man. Okay, so no menses. Okay, so as a doctor, we diagnose someone who have no stop their menstruation for a year or 12 months. So let's say if you don't have a menses for 11 months and your menses come again, that's not menopause. Okay, it's still in perimenopause. Okay, and let's say if you have a stop okay, period for 12 months and suddenly you have period, is that normal? What do you think? Is it normal? Correct, very good. It's not normal. So anyone, if you actually have been labeled or diagnosed to have menopause, which means that you have stopped period for 12 months and suddenly you have a period of spotting. That's not normal. You need to see your gynecologist. Okay, because sometimes there's early sign of endometrial cancer or endometrial hyperplasia. So that's why it's very important to check it out. Okay, and obviously, why there's menopause? Because the ovary cannot secrete this hormone called estrogen. So estrogen is very important for ladies. We are going to see after this. And this also mark the end of women fertility, meaning when you after 1 year you cannot pregnant anymore. Okay, but before that, anytime you can pregnant. Okay, although your menses is irregular, but you are still ovulating. Still, there's possible of pregnancy. And the average age of menopause in Malaysia is 50.7-year-old. So it's almost the same around the world, which is 51-year-old. Okay, so how do you know? One thing is how do you judge when you will reach menopause? It's based on your mother age. But obviously that's due to genetic factor. But however, our lifestyle, how we live, our environment, everything it contribute it will affect the menopause age as well. Okay, but however, as a judgment, we can actually take our moms, okay, menopause age. And early, okay, we label someone have early menopause if it's before age of 45-year-old. Okay, so if you have menopause at 45, it's considered normal. Okay, but if it's before 45, it's considered early. Okay, and if premature, it's before 40-year-old. Okay, so a lot of doctors, they will suggest for some hormone therapy if a person reach menopause before 40-year-old, or maybe due to surgical intervention, like they remove their ovary due to maybe cancer or maybe a cyst. Okay, so they advise them to hormone therapy to prevent all the complication that you reach menopause, okay, prematurely. Okay, so later I'll ask you again, see whether you remember the number or not. Okay, premature is 40-year-old, early is 45. Okay, so 45 to 55 is normal. Okay, and anyway, if you have, how do you say, if you menopause later, actually it's better also lah. Okay, so basically, how the estrogen work? Okay, so all the hormone, yeah, how they work? Basically, they need to have the way that actually the hormone will act upon. They will have something called receptor. Okay, just imagine the receptor is like a basketball net. Okay, so the hormone is like a basketball. Have to throw inside the net. Then only the body will function. Okay, so the reproductive organ like breast and uterus, okay, they will have the receptor. Okay, so the hormone will bind with them, then they will make the changes in that organ. So beside that, estrogen receptor is also present in the brain, in the bone, in the liver, intestine, skin, and salivary gland. So when the estrogen level drop during perimenopause or during menopause, it's not only the reproductive organ changes, but it's the whole body change. Okay, it will affect the bone, affect the brain. Then that's why it's very important to take note. Okay, and also to prepare yourself. Okay, for menopause, so that you will not have osteoporosis. Okay, or other problem later. We will look upon it. Okay, so the symptom of menopause is due to the drop in the estrogen. Okay, and there are many causes. Later we are going to run through one by one. Okay, and actually most of my presentation is from the clinical practice guideline of Malaysia. So as a doctor, actually Malaysian government is very good, KKM. Actually all the country, they will actually give you the clinical practice guideline. The doctor have to read and to follow, so that we all in one, okay, we all understand one, okay. But sometimes, because doctor in the hospital not so much time to tell you about lifestyle, so they will skip that part and then directly give you medication. Okay, so what we want to do now is to let you have awareness. Okay, by changing lifestyle, you can change your life. Okay, not only the gene say, okay, my mom have this early menopause, I also have. But if you want to change, you change your lifestyle, you can change. Like same thing for diabetic, hypertension, everything. Okay, it's not that you cannot change. You can change, but you need to know how to change, right? If you don't know, then we cannot change. Okay. And before that, we want to talk about the perimenopause. Perimenopause meaning that the hormone in the body already become imbalanced. Okay, started because we know that when we born with the follicle, ovary follicle, and during puberty time, maybe it actually left only 300 to 400,000. And by the time menopause, maybe before that, it will be like 1,000 left. Okay, so because every month, our body hormone, something called FSH, is follicular stimulating hormone, you release from the brain, okay? And then you ask the ovary, okay, you have to make some this follicle to grow, okay, and so that they will release the ovum, okay, so that we can have babies, okay. Then you release, they will actually ask, I mean, there will be a few of the follicle being mature, but there's only one which will release the ovum, so that the pregnancy can occur. Okay, so during that time when the perimenopause age, okay, there's a lot of hormonal change. Later we'll see the graph, and they can give you some symptom. Okay, the first one is auto menstruation cycle. So obviously the cycle may be prolonged, and then it can actually reduce a little bit. Okay, but however, if your menstruation become too much, okay, do you know how much is too much? Okay, anyone know? Doesn't know also. So I need to let you know. Okay, so let's say if you use a period, your pads, okay, if fully soak more than 4 pieces a day is considered too much already. Okay, and with the clot. Okay, so if you have too much period, then only you have a lot of clot. So if you have more than 4 a day, okay, for the first 2 days, obviously then it's considered abnormal. Okay, and you need to go and check, because some people might have fibroid, or maybe the endothelium, they actually, due to hormone balance, become too thick, so that they have abnormal bleeding. So all this actually can be treated if you diagnose early. So that's why health screening, okay, and awareness, okay, is very important. So early detection, early treatment. Late detection, late treatment, and then the prognosis will be worse. Okay, prognosis meaning the chance of survival, it will be shorter. Okay, so another one is abdominal bloating. I think the bloating, everyone must have this problem as well, right? Actually, have before, I mean, anyway, I haven't reached menopause, but previously, I also have bloatiness problem. But this is actually due to, I mean, you are more sensitive to certain food. Like for me, it's due to too sensitive with too much of oil. Okay, some people with too much of fiber, that's different reason. Okay, and headache, breast swelling, tenderness, mood swing, anxiety, depression, memory problem. Okay, all this, okay, most of them are due to estrogen reduction. And the most common one is vasomotor symptom. Okay, medical world, we like to make things a bit complicated, so we will not understand, and we can earn your money. Okay, so basically it's hot flush lah, like sweat and sweating. Then we make it label high panda. You cannot understand, so you have to see doctor. Okay, and the hot flush, basically 75 to 85% of the menopause lady, they will actually experience this. Okay, and whoever experience this, the person will have 2 times, okay, increase in developing heart disease and also hip fracture. Okay, and affect more than 50% of Malaysian women. Okay, however, in US and all, there are studies like 70 to 80%. Okay, and why? Later we'll know why. And then what's the treatment? Okay, obviously, I think you have some coping method, right? Some of you already reached menopause. Yeah, so you keep cool, okay, with aircon, okay, or fan, and try to rest and relax, wearing some loose clothing, and increase level of exercise. Actually, exercise is very important, because every time I give health talk, the only question they ask, doctor, what can I eat? Or, oh, doctor, what can I not eat? But never people ask me, doctor, what exercise I do? Very rare, very rare. Actually, especially in Malaysia culture. I mean, even myself, actually, I don't like exercise. But after reading so much, if you don't exercise later, you become like this. Okay, or maybe you are weak, cannot work. But however, actually, if you increase level of exercise, you are able to overcome this vasomotor symptom as well. Because when you exercise, our body core temperature will go down. Okay, and and they can actually change your brain, okay, more tolerant and able to control the body temperature better. Okay, so that's why exercise is very important. Okay, and exercise not only this. So every day I come here 3 times. Every day I'll talk about exercise as well. And then just now I saw they actually have this elastic band. Actually, it's very good. This one is for muscle training. Okay. Yeah, actually, you don't wait until only do. You have to start now. Okay, today. No matter what is your age, you should start exercise today if you are not doing that. Okay. Okay, so this one now we see what the people do, okay, to help them for relieve their flush. Okay, vasomotor symptom. This one was obviously by diet. Okay, so they actually in US, they have done this study, okay, and they give them a low fat dietary pattern. Okay, only 20% energy from fat with increased intake of fruits and vegetables. Okay, so actually WHO advise us to take 5 serving per day. Okay, so let's say if you today you take this one already, maybe 2-3 serving already on vegetable. So actually vegetable, you can take as much as you can. There's no limit. Okay, the much you take, the best they are. Okay, so for me, 5 serving is not enough. For me, maybe 7 to 8 serving would be better. So let's say if you want to skin better and all this, eat more vegetable and fruit rather than buying. I mean, skin product is important also, but more important is what antioxidant you've eaten. Okay, and they also then after the how do you say the study, they found that most of people, they actually able to eliminate the hot flush, okay, the vasomotor symptom by 1 year. Okay, so normally the flush will last for 2 years. Some people even up to 7 years or 14 years. Okay, yeah, they say it can be last for 14 years also. But you see, they just change the diet and they're actually able to lose within 1 year. So that's why now we promote whole food plant-based diet. Okay, the more fruits and vegetable you are taking, the better health you will get. Okay. Another one, it also, but this one, the smaller number, 84 of them only. Okay, so this is actually whole food plant-based diet that avoid the animal-derived food, and they try to use less of fat oil and fatty food, and they actually give them a daily half cup, 86 grams of cooked non-genetically modified soya bean. Okay, and at 12 weeks, 15% of them, okay, who actually have moderate to severe hot flush, meaning that at least 1 or 2 times a day disappear. Okay, so obviously now I don't promote you every day eat soya bean because we know every day eat soya bean also not very good Actually, yeah, actually gout is depends. This one is off topic later. I mean, if you have time, we will go to it But anyway, if you want to eat whole food plant-based diet, you need to have variety. Okay, any kind of diet actually best is to have variety and a rainbow color. Okay. Okay, why rainbow color? Okay, because all of this food actually they contain all the vegetable and fruits. They actually contain phytoestrogen. Okay, so why phytoestrogen is important? Because it can act like a estrogen, but they are not so strong. Okay, they are much more lesser effect compared to estrogen. Okay, so that's why when you eat this fruit, it can actually help you. Let's say if you are menopause already, it can actually replace a little bit of the estrogen action so that we can actually able to went through the menopause more smoothly. Because you see, actually, everyone is different. Some people don't have any problem. Okay, just went through very smooth. Some people are suffering. So now we want to tell you how not to suffer, but you need to believe and try it on. Okay, because I say so much, then later you go back also the same, then you come here, I mean, not worried. Okay. So basically you can see here is the isoflavonoid, okay, which is the soy. The soy actually contain this genistein and whatever I cannot pronounce or not. But anyway, it's still is within the soya bean, and this soya bean actually, which is the phytoestrogen that can actually help. Okay, so we go to next one. This one I think I'll skip next time. We say okay, mood disorder. Okay, so mood disorder, a lot of people during menopause, I mean, some few of the husband also is here, right? Okay, on. So, okay, I mean, I'm not sure lah, your wife went through menopause, whether they swing or not. But I think it's good that you will come to listen this health talk so you can understand your wife better. Okay, so basically, it's not the wife want to be angry or whatever, right? Because cannot control, it's due to hormone problem. That's why you have to understand. That's why the man support is very important. The spouse support is very important. Okay. So it's because due to the fluctuating estrogen and progesterone level. So what is the risk factor? Who are going to have a mood disorder? Those who have a prior history of depression, history of meaning that you have depression before, or during pregnancy you have depression, or those who have severe premenstrual symptoms, like those who have menses pain very bad, okay, and then every time that some people will have nausea, vomiting during the menstruation time, okay, they have higher risk, okay. Why? Because the hormone is imbalanced during the normal day. During perimenopause, it will be even more haywire lah. Okay, then what is the symptom? Irritability. Okay, so that's why sometimes like premenstruation or maybe during perimenopause, a lot of ladies become very easily irritable. Okay, and palpitation and poor sleep. Okay, crying spell, anxiety. Okay, but however, okay, but still quite good is it will actually become lessened when we actually reach menopause. And this is a graph to show you how the hormone changes. So this is the graph that you show. Okay, this is the estrogen level. And then you can see, during perimenopause, it's very haywire. It can be very high, then it can be very low, it can be very high, very low. So that's why the chance of depression, this is for lady, you can see for women, is much more higher when you compare to the younger age. So let's say when you're young age already have depression, during this time, is more dangerous time because the hormones become imbalanced. Okay, so have to be careful. So that meaning that you need to have a good social support. And also if you can try change to whole food plant-based diet, it can help you to control your emotional better because they've done study. Okay, yes? Oh, great. Next time you bring your husband, correct. Actually, I mean, we have to try control ourselves also, but the husband need to understand also. They just pay for maybe depends how many years, maybe 5 years or 10 years, they okay a bit. But anyway, I think most of people, if you follow the whole plant-based diet, good lifestyle, then maybe your chance of this emotional instability can be better as well. Because actually another study tells us that if you actually have 7 to 8 serving of fruit and vegetable every day is going to give you positive emotion. But let's say you eat junk food, you eat fried French fry, you eat chips, you eat, and then what else? And then all this fried chicken, whatever, fry, okay, that is going to cause you to have lower mood, okay? So that's why actually what you eat, what you do is going to affect your life, okay? So that's why it's the power of choice is very important, okay? How we want to live. Okay, so you can men is very nice, they are quite stable. I feel they're very boring. Okay, another one is okay. Actually, I mean, although we lady are more emotional, is a little bit high. Sometimes up and down. But actually, our creator is very good. It created us that we are protective from heart attack. Okay, so it's very rare for a lady to get heart attack before menopause. Okay, because the estrogen are going to protect your heart. Okay, it can help to dilate the blood vessel a little bit, and then it can help on the heart function as well. Okay, so that's why when you reach menopause, the effect gone already long. So it will be same risk as men already. Okay, so that's why a lot of ladies will get a heart attack after menopause. Okay, so and it's also there's a change in body fat distribution. So when we reach menopause, the fat actually more easily accumulate in the abdomen. Okay, so that's why a lot of my health desk tell me, doctor, I don't know why my tummy become very big. Okay, so one of possible is because of this hormone change, but obviously the fat intake also a lot. So that's why you accumulate inside as well. Okay, and decrease in physical activity. Okay, a lot of people also tell me, ayo, especially my mom, sometimes I ask her to go exercise. Doctor, mother, I'm doctor, but my mother don't listen to me. Okay, very hard. I don't know what to do also. So that's why I have to pull her to listen to other doctor help her. Okay. So she told me, I already obviously I don't have energy to do exercise. Cannot force me to do exercise. I'm very tired. Okay, so she'll say like this, but actually it's not true because the more you rest, the more tired you are. Okay, later we'll see why. And then it also there's increase in blood pressure and worsening of like lipids level. Okay, so a lot of people they actually started noted after menopause their cholesterol, especially the LDL, will increase. Okay, so that is normal. Okay, so everyone who actually after menopause, if you eat the same food, like let's say if you eat fried chicken when you are young and then when you are old, you eat fried chicken also, but the body response different lah. Okay, when you young, body able to cope, okay, to digest all the whatever fatty food you eat. But when you reach menopause, your body not able to cope already because the estrogen go away already. Okay, because estrogen actually can help the liver to throw away the cholesterol. Okay, through the bowel synthesis, because the bowel is the one way to help us to clear off the cholesterol in the body. Okay, so that's why we need to change our diet. Okay, especially when you're preparing yourself to menopause. Okay, you have to eat less fatty food. It's very important. Okay, and also worsening of glucose tolerance and insulin resistance. So that's why the incidence of heart attack is 2 to 3 times, okay, more in post-menopause than pre-menopause women. And the risk of stroke is double 10 years, okay, after 10 years of menopause. And so that's we have to control blood sugar level, hypertension, abdominal obesity, okay, and also smoking and also psychosocial stress. So that's why I always tell my I always tell my health guests or the patient, you have to lose weight now. If you reach your menopause, very challenged, right? If you want to lose weight, really. Okay, because everything, the metabolism rate, estrogen no longer there. So when you want to change, very hard. Okay, so let's say if you have overweight or obese, okay, start early. The early the change is more easily achievable. But obviously, if you post menopause, doesn't mean that you cannot achieve. You also can, but maybe you can work hard a little bit more. Okay. The next one, I think this is all the lady scared about this, right? Osteoporosis. Okay. So obviously it's part of aging. But obviously we can help ourselves. And you can see half of the bone loss is during the first 10 years of menopause. Okay, so how do we suspect we have have osteoporosis? One is you can see your height. Okay, so let's say if you actually become very shorter, it's most likely you need to check whether you have osteoporosis or not. Okay, another one, you fall down and then you got fracture. Okay, it's 100% there will be some point of osteoporosis. So how do you check? You have to go to hospital and then the doctor will do a DEXA scan for you. Okay, DEXA scan. So you can see the graph whether you are green zone or you are yellow zone or you are red zone. If red zone meaning you are osteoporosis already, and then you need to have treatment. Okay, so obviously now for me is prevention better than cure. So now we want to see how to try to modify. Okay, try to reduce the risk to have osteoporosis. Obviously, there are something which we cannot change, but here we can change. Okay, so basically we need to make sure we have enough calcium, okay, and also vitamin D. So let's say if you're not sure about your status on vitamin D, you can do a blood test. Okay, so if you go to health screening, you can ask them, oh, can I add in vitamin D? Because a lot, like Malaysia, a lot of people like to sunscreen and then put umbrella and then wear long sleeve and don't want to go outdoor because become black already. Okay, not nice. The fairer, the prettier. Okay, so because of this kind of mentality, a lot of people actually have a vitamin D deficiency. Vitamin D is very important to our body, not only for bone, but also for our immune system, okay, and then cancer prevention. Okay, so that's why it's very important to do your blood test. Okay, I'm not very promoting to do not know your level and start on supplementation because there are some people can supplement too much. Okay, if you have too much vitamin D, also is toxicity for you. And especially vitamin A also, it can create toxicity. So that's why it's best to know your level. Okay, and also secret smoking and too much of coffee intake, more than 3 drinks per day. So anyone of you, if drink more than 3 drinks of coffee, please cut down, okay? Exactly 3. Yeah. Exactly 3, I think I better, okay, so basically, I think it's, for us, we do not promote coffee intake. Obviously, coffee is very good. Okay, all the scientific will tell you coffee very, very good. But some people drink, they will get gastric. Some people drink will get palpitation. Okay, so good meaning, I mean, when something is good and there's harm, for me, best not to take up. Okay, water is the best, no side effect. Okay, unless you have heart problem or kidney failure, then the doctor say, oh, you cannot drink so much water. Otherwise, water, there's no other side effect. Okay, if your kidney function is normal, okay. So, for the normal age group, we need actually 1,000 milligram of calcium a day. But let's say you are more than 60 years old, maybe it's better to have 1,200 milligram of calcium. So let's say if your diet is enough, then actually you don't need to take supplement. But not enough, then maybe you need to take some supplement. Okay, and for women, if your vitamin D is not enough, then you need to take the vitamin D supplement. But let's say if you take calcium supplement, you must take vitamin D supplement. Otherwise, the absorption will be poor. Okay. And then another thing, okay, exercise, another thing, okay, coming, very important. If you take calcium, but you do not do exercise, the calcium not going to your bone. Okay, you eat and then you throw away, wasted. Okay, so you eat calcium, you need to exercise so that the calcium will stay in your bone, especially weight-bearing exercise. Okay, actually, no, if you have grandchildren, you carry them is considered also lah. Okay, any weight bearing, you even you climbing up the stairs is also weight bearing, just the intensity maybe not so much. Okay, so any kind of exercise that you do against the this gravity is considered as weight bearing already. Okay, so let's say some people like to go to gym because when you pay, you will do. If you don't pay, I think most people don't do. So that's why I nowadays I also subscribe apps lah. Some people also don't do So that's why actually it's very good if you have a group of friends can do exercise all together. Then it's more, how do you say, more achievable. Yeah, can talk. Then the people, hey, how come this way you didn't come? Then, oh, okay, I'll come. So we can motivate each other. So support group is very important. So that's why, yeah, if you have a group of friends, away goes this yum cha every night, then meaning it's not very effective, not very good, okay? Not very good, yeah. Okay, so now we want to let you see the calcium content. Basically, why I need to show you this because I want to let you know if you take plant-based, so you will get enough calcium actually. So you can see the low-fat milk, I mean the milk, okay, low-fat is 300 milligram calcium for 1 cup. If you drink soya milk, actually it's also the same 300. So we can substitute for the calcium. Okay, this is from the, I mean, this one I took from the US. Oh, actually, it's like, okay, anyway. Basically, I took from the US, this diet advisor website. Okay, so all this, I mean, the first two is the from US side, the green leaf vegetable. However, here I'm not sure whether we can get or not. But anyway, all the green leaf vegetable, they are rich in calcium as well. Okay, so obviously the most easier to get is spinach, right? Yeah, you can see if you take 1 cup, you already get 245. Okay, calcium. And then if you take choy, right? Choy, just now we eat bok choy, 185 milligram. Okay, and then another one. There's another kind of bok choy also. So there are two kinds. Oh, sorry, this is bok choy. Sorry, this is only bok choy. This is bok choy different. Okay, and kale also. They actually all have all the green leaf vegetable will have this calcium. So that's why it's very important. If you can have 2 serving of green leaf vegetable every day, is very good. Okay, so 1 serving, how do you know what is 1 serving? Is half cup. Okay, half cup cooked vegetable consider 1 serving. So if you eat 1 cup a day, then it's very good. Okay. And then we can see there are some other tofu. Well, tofu also very high, 434. Only half cup you can actually take. So just now you eat bak choy, you eat this one, so almost 600 already. So almost more than half already in the meal. Okay. And then okay, obviously tahini sauce. Another one is the sesame seed. Okay, sesame seed, if you take 1 tablespoon, is for, I mean, the paste, which is the tahini sauce, which is already 154 milligram. Okay, and then there are some more almond, okay, rice meal, all this is 45, they're actually 45 calcium inside. So if you're plant-based, you can see you will have enough calcium, not necessarily you need to drink milk, okay, cow's milk. Okay, another one, okay, sarcopenia, another medical term, but actually it means that there's a muscle wasting, okay, muscle loss due to aging. Okay, that day my mom told me, hey, you see, my leg so thin, I become very skinny already. Then I say, Mom, this is not correct. This is not become skinny. This is muscle wasting. And then a lot of auntie tell me, Doctor, I feel my leg is very weak. I scared I got stroke. But actually, most of the time, if you have one side weakness, maybe stroke. But both leg weakness is not stroke. Most likely it's muscle wasting because this is a physiological changes. Meaning that if you don't do any exercise, you're going to lose your muscle. Okay, so let's say if you want to do experiment, you can lie on the bed for 2 weeks. Then you will see your muscle all become very less already. Okay, because there are some people have fracture before, right? They will put on cast. When they open, they see what their leg become very thin. Okay, because more than 2 weeks, I think they put for cast for 6 weeks. Yeah, so all the muscle, if you don't use, they are going to waste. So that's why it's very important to do muscle training exercise. Like just now, this kind of elastic band, is also one kind of muscle training as well. So it's very important, especially the muscle wasting actually more on the calf muscle, leg muscle compared to the arm. Okay, so if you don't do any exercise, later on you maybe cannot walk, then need to sit on the wheelchair. Okay, and above 40-year-old muscle mass and strength decline. When I read this, I'm turning 40 this year. So actually now I started doing more muscle training. Previously I do only walking or hiking. Yeah. But nowadays I also try to do more muscle training because I don't want lost muscle and then cannot walk, cannot do anything, then it's very terrible. Okay, and it says that if you don't do anything, up to 80-year-old, you're going to lose 50% of your muscle. Okay, and obviously the cause is due to the hormonal changes, loss of physical activity, or maybe reduced protein and calorie intake. Because a lot of when we age, our teeth also not very good. So sometimes when we didn't chew well, and also it actually affect the intestine as well. When the estrogen is low, you are not able to absorb the protein so well. Okay, so maybe that's why you actually have a reduced protein and calorie intake. Okay, and there's increase in oxidative stress. Okay, oxidative stress basically is another word is, I think, free radical. Everyone listen before. Oxidative stress, maybe you don't listen, but it's the same thing. Okay, so basically the free radical from all the pollution, from the sun, UV light, okay, from the inflammation, any kind of abnormality in your body, it can cause inflammation because the process of healing actually is called inflammation. But however, if the condition didn't become better, our body need a long time to heal it, and because maybe of lifestyle, you didn't sleep well, or maybe you still eat a lot of high sugary food, okay, or eat all the inflammatory food, then your body not able to settle the problem. Then they will always form all these free radical. Okay, metabolism also. So let's say if you eat refined food, okay, the refined food actually do not contain so much antioxidant. So that's why it will create free radical also. So that's why you need to eat whole food. Okay, instead of white rice, you should eat brown rice, okay, or millet or quinoa. Okay, and smoking, they also give you a lot of free radical, all the radiation, air pollution. Okay, so all these free radical, it will attack the gene. So it will actually damage the cell and cause problem. Okay, lead to cancer or maybe diabetic or any other problem, and aging as well. Okay. And the next one is genital urinary symptom of menopause. So basically, a lot of ladies, they will actually have a vaginal dryness, painful sex, sexual dysfunction, bladder and urethra symptom, and frequent urinary tract infection. Okay, so basically, this is also part of the estrogen level become low. Okay, because it will lead to thin and dry vagina epithelium, and there will be a change in vaginal flora and loss of lactobacilli. So I have a friend, she have a recurrent UTI, and she always have burning sensation on passing urine and always feel dry, very uncomfortable. So she always take antibiotic because always check there's a bacteria in the urine. And many times. So she's fed up already. So finally, a doctor asked her to use this low dose vaginal estrogen. Actually, all the symptoms subside. Okay, so for me, I think like let's say if you try everything already, but it's still not settled, I think there's actually, how do you say, estrogen, although everyone feel that, oh, there's a risk, okay, we increase all this cancer, but however, I think if your life miserable, it can lead to cancer as well. So I think if you bear the risk and the benefit, I think the topical, all this vaginal therapy is still acceptable because actually they use its cream, tablet, or ring. Okay, and it will have a minimal systemic effect only. Okay, so let's say some people they are suffering all this. Actually, you can see a gynecologist. They can prescribe you the vaginal cream so that you can actually have relief and not to suffer so much. Because some people when they have this problem, they cannot sleep well because every time you wake up and then go to toilet. Okay, and they will feel dryness as well and itchiness as well. Okay. For connection is about the brain function. And estrogen also have shown a positive effect on long-term connection, meaning that the person is able to think better, okay, and they can judge better, and they can have better brain function, okay. And so the women have who are older at the time of menopause will have a better cognitive function, okay, particularly in verbal memory. So why? Because the brain also have the receptor, okay, in the prefrontal region, which is the judgment. Okay, another one just now, the mood swing is in the hippocampus, which actually it will control our mood. So all this brain actually have this estrogen receptor. So whenever the estrogen level go down, then it will actually unable to, I mean, it will not function as previously anymore. So the function will decline. Okay, and the skin, okay, so obviously 30% of skin collagen may be lost within the first 5 years of menopause. Due to loss of estrogen, the skin will become saggy, wrinkle, thinning, dryness, itchiness, hyperpigmented skin. Okay, so for me, actually, one of the way to reduce the dryness actually is to put moisturizer. Okay, moisturizer, or you can use oil. Okay, nowadays actually one of my friend introduced me vitamin E oil, so I actually try. I think quite good also. Then I've seen some people. Okay, one of the some people they also use olive oil. Okay, any kind of oil like I mean Indian culture they use coconut oil also is good. Okay, for the face and also I think they use neem oil also. So any kind of oil basically is moisturizer. So let's say if you're not sure which one is good, you can actually keep changing because our body need different kind of nutrient. So if you keep changing, it can provide different kind of all this nutrient to your skin as well. Okay, so that's why then you can choose which one's better. Then maybe you can keep rotating them. Okay, because each person have different requirement on the nutrient. Especially, but obviously you need to eat healthy as well to have very high antioxidant intake. Okay, and there's many other things for the hair. Okay, then they will have tooth loosening of the teeth, gingivitis. Gingivitis basically is the inflammation of the gum. Okay, so one of my dentist friends share that actually a lot of study also shown that coconut oil is very good for the oral hygiene. So after I listened to my friend sharing and also I looked through the internet, there's a lot of studies say that coconut oil actually is antibacterial effect. So whenever I have a toothache, you can do something called oil pulling. I mean, oil pulling is very easy. You just keep the coconut oil in your mouth for 10 to 20 minutes and then you just throw it. Okay. Then I try a few times. Every time I toothache, I do the next moment no more pain. Okay. So that's why nowadays I don't need to see dentist so much. So because you see dentist, they also, I mean, they also help you to fill the hole only. So but however, this coconut oil really can help you to how do you say take care of your oral hygiene. Okay. And then another thing the dentist tell me, you brush teeth, don't brush too hard because you are going to have this increase the gingiva atrophy. Okay, it will become recession even faster. Okay, oral candidiasis and painful mouth, all this can help with coconut oil pulling. Okay, and dry eye and cataract problems in postmenopause. This one recently, okay, this one I haven't seen anything yet lah, but you need to use eye drop. But that day okay, this is not from a medical doctor perspective. I just heard the video. I'm planning to try also on castor oil. Okay, they say they put castor oil on the eye, and then it seems become more, how do you say? I'm not sure. They say that more brighter. But I also want to try. I bought already. So if next time I see you after 1 year, I'll tell you whether effective or not. Yeah. Okay, and then hoarseness of voice, dry mouth, and then loss of sensory. Okay, so the CPG, okay, Malaysian guideline, they advise for lifestyle changes in order to overcome the menopause. Okay, so obviously you need to maintain a healthy weight and you need to eat healthy. stop smoking and reduce alcohol consumption, and try to optimize your blood pressure and glucose level. So that's why we need the WHO recommend that regular exercise five days a week, 30 minutes each time. Okay. So basically it's 150 minutes per week. Okay, you can actually split it to 3 times, 10 minutes. Okay, it's more achievable, yeah. So if you don't have time, you can do just 10 minutes. Okay, after each meal, if like let's say you have lunchtime, you can use half to eat and half to exercise. Just walk in the aircon area lah, so you not sweat, right? Because a lot of time I told them, oh, you can walk after lunch. They say, doctor very sweaty, cannot lah. Okay, then you walk in the aircon room, right? Then you will not sweat. Okay, so if you break into 3 times, 10 minutes each. Okay, sleeping is also very important, 6 to 9 hours. So nowadays I also invest on this band. Actually, they can track how you sleep, and then you know how much you have walked. Okay, how much calorie burn. So sometimes it's a good idea to have a smartwatch. Let's say you want to change, because you will feel rewarded. Wow, I did already. I burned so much calorie. Okay, and then you also know whether you sleep better or not. Okay, and about stress, need to stress control and support group program, especially the spouse support. Yeah, so that's why I'm very glad that our Mr. come over and listen to our health talk. So you can actually give your wife support, because I think the support is very important. Okay, someone understand you and someone doesn't understand you make a very big difference, right? Yeah, let's say all the husband is very understanding, I think I'll get married also lah. But I'm so single. Okay, so and then next one is minimal saturated fat, trans fat, salt, and sugar. Okay. So they found that hot flush will be aggravated with excessive coffee and spice food. So let's say if you have hot flush, maybe you can try to reduce the coffee and the spicy food intake. Okay, so maybe you become better and try to eat more hot food, plant-based diet. Okay, and drink more water. Okay, limited sweetness beverage. Actually, if you drink water, it can increase your metabolism rate also. It's the most easier way to increase your metabolism rate, just by drinking water. Okay, so basically anything is too extreme is no good, right? So warm actually is best lah. The room temperature, okay? Because if too cold, your stomach need to warm it out first, okay, for food digestion. If it's too hot, sometimes it might burn your throat, okay, and the lining. So that's why too hot or too cold is not good. Okay, room temperature will be the best. Okay, and try to limit fried food. Okay, twice a week or less, because all the fried food will give you oxidative stress. Okay, I think my sharing until for this one more. So have to replace the saturated fat. Okay, especially the animal fats and also the trans fat. Okay, so trans fat basically is how do you say, human made fat. Okay, so basically they change the bond, especially the vegetable oil, then become butter, like those margarine. They are actually human made. So that's very bad for our body. Our body cannot digest them. Okay, so you can find why they want to do why they want to create this one. Anyone know trans fat? Why they want to create this trans fat? Because they can sell more. Okay, the shelf life will be increased. Anything they actually make with trans fat, margarine, or they fry them. Okay, or hydrogenated, or when you buy the food, you see partially hydrogenated coconut oil or whatever oil. Okay, or plant-based oil. All this is trans fat. Why they want to use it? Because it increases the shelf life, meaning that the food can stay longer and then they can earn more money lah. So nowadays, basically it's about earning money. So a lot of company, they do all kind of thing to earn more, okay, but they didn't see about the people health. Okay, so we try to eat more healthy fat, like we will more promote on the olive oil, okay, and try to take nuts, okay, 1 handful a day, almond and walnuts and any kind of nuts, okay, and try to substitute animal source of protein, example meat and chicken with plant-based source of protein, okay. For us, obviously, we are whole food plant-based, so if you can replace all will be the best. But let's say if you're very hard on cooking or preparation, then you can actually try to cut down, okay? Try to change as much as you can, okay? So when you actually, because our taste bud needs some time to change. If you too drastic, life too miserable, okay? Because sometimes I ask, like hypertension, I say, oh, you cut down your salt, then the next day the patient very sincere, don't put any salt. Then now cannot eat, tasteless. Then how you think the person is going to take a long time? I mean, follow not sustainable, right? So that's why you cut a little bit, you don't, your taste bud will change and you didn't notice. So this is what our government do now actually. From 19th century until now, they actually make the company force them to reduce the salt and also sugar. So that's why nowadays actually our food that's not so how do you say, not so salty, but it's still salty, but at least compared to previously actually have improving. I think they were, according to a newspaper, they actually reduced 1 gram salt. Okay, that for 1 day, okay, a person take the salt intake, they already try to cut down 1 gram already. Okay, so that's why if you want to do changes, have to do it slowly. Okay, so thank you very much for listening.